both positive and negative, as we've learned. Provinces have adopted their measures. Health institutions are refining their measures and optimizing their services. For example, Shanghai requires all clinics and outpatients clinics of hospitals should have the proper zoning for NAT negative patients and positive patients. And in the ER zone, for the critical cases, the city-level hospitals are responsible to take in these patients, and the hospitals must be prepared to expand their resources. Beijing, Wuhan, Nanjing, Nanchang, and multiple cities have requested hospitals to set up the receiving areas for both positive and negative patients. And in ER areas, those with a 48-hour NAT negative result are allowed immediately into the ER areas, and those without a 48-hour NAT negative result are allowed into the buffer zones. For diagnosis and treatment, localities have requested that no reason can justify the refusal to any patient. Going ahead, we will continue to boost our guidance to localities, continue to monitor and inspect health institutions so that they can constantly improve their service capacities and maximize the services provided to the general public. Next question goes to the journalist from the left side. With People's Daily, after the adoption of the new 10 points, most of the COVID positive patients are having home-based treatment. Does it mean that from the testing through diagnosis and treatment, all have to be taken up by the general public themselves? I'd like to invite Mr. Gao Guangming to take the question. Thank you for your question. On the 7th of December, the General Office of the Interagency Task Force issued this new 10 points to further optimize prevention control and containment measures. On the same day, the General Office of the Interagency Task Force issued the guidelines for home-based treatment of COVID-19 positive patients, providing detailed guidance to the general public, and these can be accessed on NHC's official website. I'd like to emphasize several points. First, following the categorized and classified treatment, eligible coronavirus positive patients and mild cases can have a home-based treatment, and they can select appropriate medication for their own treatment. For aggravated severe cases, in light of the reality, they can drive themselves, their family members to the hospitals, or they can call for ambulance. In the diagnosis and treatment protocol, it explicitly points out that grassroots level community health institutions must have people on duty 24 o'clock around the clock to take the questions and consultancy from needs from the general public. NAT testing and environmental disinfection efforts will continue. We, of course, see many areas that are still awaiting further improvement, and we solicit the general public's suggestions. Next question goes to the journalist from the second row on the right side. With the financial channel of CCTV, we've noticed that the general citizens are showing increasing need for the COVID treatment medication. What are the efforts made in ensuring the production supply of COVID medicine? Mr. Zhou Jian is taking the question. In general, the production capacity of COVID medicines can meet the needs of the general public. Recently, with the number of patients on the rise, there has been a surge of COVID medicines. There has been some shortages in certain localities and on some varieties of medicines. We have tapped into the country's system an institutional arrangement and rapidly promoted the production capacity expansion of businesses with a focus on the key medicines. We've guided enterprises to reasonably and orderly increase their production capacity to alleviate the tight supply on the market. First, we've been focusing on improving production. In response to the adoption of the 9th version of Diagnosis and Treatment Protocol and the home-based positive patient intervention guidelines, we've listed some drugs and we've expanded production capacity of such medicines. We have set up a list of the key production manufacturers to ensure stable and orderly production expansion. We've sent contingents to these businesses and worked along with local departments to ensure the supply of key medications, with a focus on addressing the pressing difficulties in logistics, labor supply, electricity, water use, raw material procurement, so that businesses can strive out to full steam production. Second, we've adopted an array of measures to promote key businesses to expand their capacity. We helped businesses to set up tailored strategies to expand their production.
Also, we have the entrusted production to dig the potential of the current production capacity to improve the production. We guide the enterprises to improve the technology, to improve the efficiency, and the fever killers will be the main product. And also, we have the monitoring system for faster response to try every means to improve the production. Thirdly, we have a precision distribution to ensure the needs of the key groups. For those who are holding and who have made it very difficult for people who really need the drugs, we have a precision distribution that is a key to solving the mismatch of the demands and needs. We guide all localities to have some proper plans to give priorities to those groups that are in urgent need, to ensure the distribution of drugs to the medical institutions, home aged care facilities. And also we have the online platform for drug selling. Through submitting the test result of the antigen test, we can send the drugs to the patients timely. I believe that all the production potential will be fully released to meet the patients and the needs of the public, because we have a very strong industrial base. Let's continue with our Q&A. Thank you very much, moderator. From Health Daily, people are concerned about Western medicine and TCM medicine. Can they be consumed together or separately, which is much better? Liu Qingquan would answer your question. Thank you very much for your question. That is a very important question, because currently, in view of the infected population, according to our result of research and clinical use, the TCM and the Western medicine can be combined to treat the fever and relieve the pain. But for the safety concern, they should be consumed or taken half an hour later in between. For Chinese medicine and Western medicine, the combined use of both can be complementary, and it can relieve the symptoms faster, such as to cure the pain, to for the fever symptoms and coughing, all can be relieved. Over the past few years, we have combined use of TCM and Western medicine. They have been tested and very effective in treating fever and cold. Until now, we haven't found any negative impact of taking both TCM and Western medicine. We have reviewed the literatures. We haven't found any negative reaction by taking TCM and Western medicine. However, it is suggested not using several kinds of TCM and Western medicine, and it will not be as fast as you expect. If you take them all together, there will be like the overdose if you take them too much, and that will be kind of risky, and it is not as effective as you believe. If you take a look at the TCM with the component of Western medicine, when you are taking such TCM, you need to be careful. Otherwise, there will be overdose issues. There will be negative impact. So currently, the combined use of TCM and Western medicine can relieve the symptoms. Thank you very much. Thank you very much, moderator from China News Agency. I'd like to know for the question for vaccination. Some people with existing conditions, they are concerned about the consequences of the vaccination. What are the concerns for the vaccination, and what is the process of vaccination? Xiaogang will address your question. Thank you very much for your question. By December 11, 2022, 3.4 billion vaccines have been injected, and covering 1.3 billion, over 1.3 billion people, and full vaccination covers over 1.2 billion, accounting for 92.66% and 19.36% respectively. People over 16 years old have been vaccinated. The number is over 200 million, 39 million, and the full vaccination covers over 200 million. That is about 19.9% and 86.5% respectively. Enhanced immunization covers over 100 million. People over 18 years old have been vaccinated, and the number is 27.619 million, covering the total population of the aged people as 77.1% and 66.2%. Enhanced immunization covers the aged people over 18 years old of 14 million people. It has been proven from clinical experience that the people over 16 years old, and in particular 18 years old, if they have the preconditions and they are infected, there will be a high possibility of severe cases. So in the national documents, and we found that there are some taboos for the old population in vaccination. For instance, they have very severe reactions like the allergy and high fever and a very severe attack of their chronic diseases. So these are the concerns or the possible consequences for immunization for the older people, or they already have the chronic diseases. For people who have a high fever and the people who have a heart attack and also who have immunization problems and the attack of some other diseases, they need to be very careful about vaccination. Accordingly, we provide some training at a local level to guide the vaccination of the people. For instance, we have 4 requirements. We need to have medical staff on site for vaccination, some emergency medical supplies, and ambulances, and also the fast track for the medical guarantee. So the old people, they can rest assured for vaccination. In case there are problems, it will be properly handled. And if you have no taboos or no pre-existing conditions, and we encourage everybody to be vaccinated. From Southern Daily, it is reported that in some places there is a shortage of medical resources and difficulties in getting treatment. How to address that issue? Zhao Yahui will answer your question. Thank you very much for your question. We have been following this issue closely. Recently, in the outpatient, a lot of patients with fever, there is a gap between supply and demand. For ordinary outpatient and the inpatient, it is very normal. Currently, for the hospitalization, the resources is very sufficient and everything is very normal. For the fever outpatient, there is a surge in the demand. We have taken a number of measures.
First, we expanded the supply of medical resources. We require all the hospitals at second level and above must set up fever clinics. In recent days, we are robustly promoting such efforts. As of 14th of December, among all the hospitals above second level, more than 14,000 fever clinics have been set up. Grassroots level health institutions have established more than 30,000 fever clinics. While we increase the number of fever clinics, we will further streamline the medical service procedures. For most of the patients, if they go to fever clinics, they want to get medicines prescribed for the treatment of COVID. And so many places have set up streamlined fever clinics to expedite the services delivered to patients. The hospital visit time has been shortened from 4 hours to within 40 minutes. Health institutions at localities are also increasing the numbers of designated hospitals, quasi-designated hospitals, the expansion of treatment capacity in hospitals at the tertiary level and above. They've increased the ICU beds, improved the capacity training of the professionals working in ICUs. We are intensifying and expediting efforts on all these fronts in all the provinces and the localities. Dedicated funding support have also been channeled to such efforts. Second, we continuously improve classified and categorized diagnosis and treatment. In urban hospital alliances and in rural paired up hospital alliances, we have been expanding the classified COVID diagnosis and treatment. All 3 levels of hospitals in both urban and rural areas are implementing these efforts. Grassroots level health institutions are carrying out health monitoring of people at risk. Hospitals at the second level and above are providing technical and personnel support. to ensure the basic medical needs of the patients are met, and hospital at third level and above are treating the most severe patients. The classified system has helped us to set up a sound order. Third, we are promoting telemedicine. Telemedicine can help patients with symptoms with online diagnosis and treatment and home-based treatment. Patients can access medical services online, and third-party supplier will deliver the drugs to patients. We also encourage health institutions to provide online consultancy, medication prescription, and appointed diagnosis and treatment. By so doing, we can stagger the peak in hospitals and minimize the possibility of crowding in overcrowded hospitals, and thus minimize the risk of cross-infection. Fourth, we constantly optimize the procedures in fever clinics and ER rooms and hospitalization to provide convenience to patients when they seek medical services. Going ahead, we will continue to guide localities and health institutions at all levels to further operationalize our measures. We will implement a combination of measures to enhance the supply of medical services and provide greater convenience to the general public. Journalist from the third row on the right side, please. With the 21st economic news, the new 10 points have paired up community services with health institutions. What is this pairing up mechanism specifically referring to? How can we ensure timely and effective and convenient medical services are provided to the seniors and patients with chronic diseases? Mr. Gao Guangming is taking the question. Following the principle of health monitoring, categorized management, coordinated measures to provide effective treatment. As we deepen the health sector reform over the years, we have been robustly promoting the building of urban hospital alliances and rural paired up hospitals to ensure better coordination vertically and horizontally. This mechanism has been in place for many years and has been proven effective. The referral system has been smooth. So this paired up system has already been in place. Important thing is that as we adopt a new 10 points for coronavirus positive patients with mild cases and asymptomatic situations with underlying diseases, we suggest that they can have self-treatment. In home-based environment, health institutions can provide telemedical guidance. So it's a combination of online and offline services for patients with severe symptoms or who are prone to develop into severe situation. They can seek medical services in dedicated hospitals. They can also seek advice from the community hospitals for further referral. If the situation is severe and critical, they can go directly to designated hospitals. Thank you. Next question goes to the journalist on the second row on the left side. With the Hong Kong Economic Herald, some netizens say fever medicines are sold out, including TCMs. There are only several types of fever medicines effective on the market for the treatment of COVID. Mr. Liu Qingquan is taking the question. This indeed is a very important question. After 3 years of evolution, in the theory of TCM, the virulence of the virus is attenuating. Its transmissibility is strengthening. Compared with the original variant, The greatest feature of Omicron in traditional Chinese medicine theory is it's the wind and heat invasion of the lung. So the core pathogenicity is the same with that of influenza and cold. In traditional Chinese medicine theory, different diseases, if they have the same root causes, they can get the same herbal treatment. It is not limited to the 3 formulations or 3 decoctions. In light of the features of Omicron, because it is because of the wind and heat invasion of the lung, so all the medicines, herbal medicines that are effective for the treatment of cold and influenza will be effective for the treatment of Omicron-triggered COVID. TCM administration can shorten the fever period, and if we can add some painkillers, it will be of a more superior efficacy. The combination of TCM and Western medicines will be an important measure to alleviate the symptoms. It may take much longer for TCM to show its effect, but the effect once is materialized will be lasting. So TCM and Western medicines are mutually reinforcing each other, and TCM is effective in shortening the fever period and alleviate the body aches. The National Administration for Pharmaceuticals has approved several hundreds of TCM.
To cater to different medical conditions and targeting different population and different symptoms. There are some variations in selection of the drugs. We can use a wider variety of TCMs and Western medicines for the treatment. It is not only limited to a few choices, we have many choices. The third row, the journalist. Thank you very much. I'm Hongxin News. We have noticed that for the state COVID control, they have the immunization program for the second booster. And when will this start? And targeting which population? Xiagang will answer your question. Thank you very much for your question. The vaccination is a very important means for COVID control. Still, now we are facing a very severe situation. In particular, the elderly people are in high risk. To ensure the health and safety of our people, in view of the vaccine research and emerging use of the vaccines. Recently, the State Council Joint Control Mechanism has made a little improvement adjustment for the high-risk people and people over 60 years old and those with pre-existing conditions and people who have a vulnerable group. 6 months after the first dose, they can have the second booster. Currently, all the 13 vaccines which have been approved for emergency use can as a second booster, including the 4 vaccines for emergency use. We highly recommend the vaccines that contains the Omicron strain or those vaccines that can have a very good effect in responding to Omicron. You can follow our website for the relevant information. Currently, we are working on implementation. Please follow the local information and conduct vaccination according to the local arrangement. We encourage all qualified people group to be vaccinated. The second row, right side. Thank you very much from CGTN. Currently, we have found that according to the statistics, the infected cases are declining. However, the public feel the other way around. And why there is no figure to be released about those people without symptoms? What is how to conduct the future monitoring and also reporting? Li Chun from CDC of China will answer your question. Thank you very much for your question. On January 20th, 2020, COVID is the type B infectious disease according to the infectious prevention law, but we have taken the level A, the measures for type A. So according to the prevention law of infectious diseases, the medical institutions at all levels need to report to CDC, online report and real-time report about the infected cases or suspected cases. Recently, we have seen the decrease in the reported cases, which are not felt the same way by the public. There are several reasons. Firstly, after the new policies being adopted, we will not have the universal testing COVID test, in addition, except for the key group and the key places. Therefore, the total people being tested, the number is declining, and there are few medical institutions that have been doing this test. Second, those people with light symptoms or no symptoms, they can have the test at home. They don't have to go to medical institutions. Therefore, this information is not included in a report system. And second question is why do we have we stop the figures about people without symptoms? It is because people are not going to the test points or to the health institutions. Therefore, we have no way to know exactly the number of the people without symptoms. Therefore, since today, we will not release figures on people without symptoms. However, the grassroots health institutions will provide guidance for them for home monitoring and provide health services accordingly. Next, we'll continue to have the monitoring and a report based on a national CDC reporting system, and also we will have all other forms of monitoring. We'll also have the monitoring and a report of the key institutions like the aged care facilities, health institutions, welfare facilities, school, and other institutions, so that we can know, will follow exactly or timely the involvement of the virus, and which will be the basis for decision making in the control of the pandemic. Thank you very much from Oriental TV. There is emergent need for the health services, but ambulances will not come, and it is being said that there should be a fast track for the referral between the grassroots facilities and the higher level healthcare facilities. How does that transfer system operate? Thank you very much. We have some feedback from different places about the problems with the hotline as well as the ambulance issues. There is a shortage of the ambulances, or the coordination is not there. In winter times, there is a lot of flu and seasonal cold like that. There is a big demand for ambulances in previously. However, we also learned that some hotlines from the patients or the infected cases, some of them are not showing symptoms. They just ask some questions, but there is no immediate need for healthcare services. So we have done two things. We ask grassroots healthcare facilities to release or to make the hotline public. For people in Beijing, please follow closely the official WeChat account of the healthcare facilities, institutions, especially the grassroots facilities. We hope that at the grassroots level, the questions can be answered. And also for the empty nesters and the pregnant women, people with pre-existing conditions, and people who have special medical needs. We need to provide them with healthcare services guarantee, and also more need to be done for the referral system. The channel is smooth, please rest assured. And we here call for the coordination and support of all people to leave the emergent health services to those who are in real need, to make sure that this channel is smooth. Thank you from Fengmian News. Telemedicine can reduce the number of visits to hospitals. It is very convenient for people. However, we learned that the telemedicine is not very smooth. The channel is not smooth, in particular for the old people. How can we play the role of telemedicine in the COVID control and make it more friendly for the elderly people?
Madam Zhao Yahui is taking the question. Thank you for your question. To better serve the needs of the general public in seeking medical services, we have intensified our efforts to promote telemedicine. On the 11th of December, the General Office of the Interagency Task Force issued a policy circular on improving telemedicine during COVID-19 response. We require health institutions to provide telemedical services following the diagnosis and treatment protocol and the home-based treatment guidelines. Telemedical services will be provided by health institutions to the patients, including prescription of drugs and the delivery of drugs. At the same time, we encourage health institutions to provide online consultancy around the clock and to promote staggered visits and appointments for the non-emergency services. It will have a precise appointment made for the patients. By so doing, it can shorten the waiting time of patients and avoid overcrowding in hospitals, thus minimizing the cross-infection risk. We also advocate the general public to have an online appointment. If you have already made an online appointment, make sure that you go to hospital as you have reserved the time slot. Avoid going to hospital at too early time so as to shorten your waiting time. We've noticed that in Beijing, Shandong province and many other places, the list of hospitals who provide telemedicine services are publicized so as to provide convenience to the general public to seek telemedical services. The question you asked is about the elders' access to telemedicine. Last year, in one of our programs to provide solid and tangible convenience to the general public, we've issued a policy circular on further facilitating seniors' access to medical services to bridge the digital gap of the seniors in seeking medical services. We require health institutions to optimize the telemedicine service online. They are also advised to provide the voice navigation to the senior citizens so as to facilitate their visits to online services. We also ask the family members of the seniors to have appointment made online. And so we have learned many localities have adopted targeted measures to provide convenience to the seniors. We've learned that the city of Shanghai has set up a model of the nursing home plus telemedicine model so that those living with nursing homes can also access telemedicine. West China Hospital in Sichuan province has also innovated their telemedical services by adding many functions including voice navigation and further staffing up their call centers to provide better services to the seniors. If eligible, and senior citizens can also go to the community health service centers. Within the hospital alliances and paired up services, the community hospitals and community health centers are also providing telemedical services to senior citizens. With the myriad of multiple measures, we hope we can better meet the needs of the senior citizens in seeking medical services. Next question goes to the journalist on the left side from Macau Monthly. What are the health tips for children if they use TCM? Are there any differences from the use of TCM from the adults? Thank you for your question. When children contract the disease, naturally adults and their parents are most worried. In the theory of traditional Chinese medicine, the core mechanism and core pathogenicity is the same with that of adults. But when children develop the COVID-19, they also show some GI reactions. Therefore, when we select TCM for the treatment of cold of the infants, we should select medicines that work against wind and heat invasion of lungs. But when there is no available dedicated drugs for children, then when we select an ordinary drug for the use of cold treatment for adults, we must read the prescription as to whether there is any recommended dosage for the children. And we do not recommend the combination of cold TCM treatment medicines. When children have the intake of TCM, most of the TCM tastes bitter. So it's difficult to administrate the medication for children. We suggest that the medicine can go along with liquid, and we can reduce the dosage and increase the frequency of intake. When children take TCM, we may find more frequent defecation of children. And if it is a fever medicine, children usually sweat a lot. We must ensure our children have more water so as to prevent protraction. Children should also have a nutrient diet to ensure the balance of nutrients. children and infants below 3 years, young children below 3 years old, we find it more difficult to have the intake of TCM. Then we can provide them with massage. Many provinces and localities have issued technical guidelines on promoting massaging for children for the treatment of cold headache. There are many infographics and easy animation for parents to learn. And many of these infographics and animations are put online. Simply by scanning a barcode, you can learn these techniques that can be easily used for the treatment of children when they are infected with cold or when they develop COVID. It is a very important non-pharmaceutical way to help our children. Thank you. Next question goes to the journalist from the third row on the right side. With Guangdong Radio and television, the pandemic containment is faced with new situation and shouldered with new tasks. What is the production and supply of key medical supplies, including antigen test reagents, vaccines, and masks? Can this satisfy the needs of the general public? I'd like to invite Mr. Zhou Jian to take the question. Thank you for your question. This is a question very much under limelight. Ministry of Industry and Information Technology, following the deployment of the Party Central Committee and the State Council, has made solid efforts in ensuring the production supply of medical materials. We've been rescheduling the productions, improving production capacity, stabilizing the supplies, and making well-coordinated efforts to ensure the supplies can meet the needs of the pandemic containment.
We have optimized some measures with 20 points and 10 points being issued. We have better coordinated the production of the test kit and the PPEs and the vaccines. Now let me share with you the current situation of the key medical supplies. First is the test kit. China is a big producer of the test kit. Currently, the National Medical Products Administration has approved 42 antigen test kits, and we have a wide list of the producers. Every day we have cooperated with the MIIT at the local level to address the issues in the daily operation of these enterprises to ensure that production is guaranteed. And also we have bought or procured the raw material to guarantee the raw material to make sure that the supply chain is stable. China has the largest vaccine production line in the world with an annual capacity of 7 billion doses. We have provided 5.5 billion doses. That is sufficient for the current situation. At the moment, we will do a good job in the production coordination, quality management, and the supply of the vaccines. Third is the masks and other PPEs. PPEs industry in China is very solid. Since the occurrence of the COVID, masks and PPEs production boosted. That can meet the demand. Recently, with the need for N95 masks, we have better coordinated production to make sure that the needs is met. Generally speaking, the antigen test kits, masks, vaccines, and other key medical supplies are sufficient. There is some shortage, temporary shortage of the test kits because previously the market demand was very small and there is a very small stock at the pharmacies. With the production capacity increasing, the production will come up very soon. That is enough for the public's needs. Final two questions. The third from on the left side, from Shenzhen TV, we have observed that the vaccination rate is over 19% in the general public, but some people with chronic disease, they cannot get the vaccine because they are in the period of attack of this disease. How can we reduce the risk of death? Gao Guangming will answer your question. Thank you very much for your question. For the small population without the possibility of being vaccinated, we have issued the programs for the key population, and we have basically two requirements. Firstly, we require the grassroots facilities to play their role as the distributor of the information. The individuals also need to have a very good health habit and the life habit. First, for example, wash your hands frequently, and also you need to avoid gathering in the family. People need to have a good ventilation and also proper disinfection of the daily items, and also good regular exercise is very important to ensure also have a good diet. So at the personal level, you need to have a good habit to keep your immune system strong. And even if you are infected, do not go panic. You can follow the guidelines for home quarantine or for treatment. If there are severe symptoms, go to the health facilities, including the grassroots facilities or the big hospitals, timely for advice of treatment. It is fairly to say that people can recover very well once they are infected, and our health system has a very effective program for treatment. We have combined the use of TCM and Western medicine, and we can have very standardized treatment to avoid severe cases or the death. Thank you very much. Last question. Thank you very much. From Economic Daily, we have noticed that with the 10 new points, people are concerned whether they're being very well implemented at the grassroots level. How can you provide guidance to the local level for the implementation of the 10 new points? Xiaogang, please. Thank you very much for your question. For the 10 new points, it is being implemented very fast at the local level. For instance, the Health Commission and the CDC have optimized their management, which is dynamic, and also they have come up with a detailed implementation plan. In particular, for the elderly people, the vaccination is going on, and also guiding localities to optimize their resources to ensure a smooth transition. For the transportation sector, they have also optimized the measures. The checkpoints have been lifted. There is no need for the check of the health code. And also for the monitoring agencies, they are following closely the price of the drugs, and they are accelerating their efforts in monitoring the price, including those at the e-platforms. they have issued some notice on the price monitoring. They reminder for the distributors and their 9 no's for these enterprises, for these distributors. And also there are some guidelines for the culture and tourism sector. There is a new version of the notice for this tourism industry, entertainment, culture sectors. There's a new guidelines for the tour guides. They need to show their health code. This is only limited to the tour guides. It is not necessary to check the health code of other people. As for the other sectors, they all have come up with optimized measures and guidelines with the 10 new points. The state prevention mechanism has optimized its guideline and also make sure that the complaints from the public is very well responded. And also the State Council is providing guidance to the local authorities in combating the extreme measures of COVID prevention. And there have been a complaint hotlines which is running 24 hours. And all these measures can properly handle the complaints from the public. Now, across the country, in 31 provinces and autonomous regions, they all have their optimized implementation for the 10 new points. They have adjusted their measures, and everything is now going on very well. Thank you very much. I'd like to thank all the speakers for their information about the healthcare services and the drug supply issues. Later on, please follow us closely. We'll have more press conferences on these issues. Thank you very much.